Also, in this, we can take another example. Uh, some diseases run in the family. For example, diabetes, hypertension, breast cancer. If, for example, if both parents have uh, if both parents have diabetes, their children has the higher chances of developing diabetes. Having a genetic risk does not mean a person will definitely get the disease. It only increases the chances. Genes load the gun. Lifestyle pulls the trigger. Okay, then we will move to the next slide, which is lifestyle and modifiable risk. So what do we understand by modifiable? Something that we can change. For example, our poor diet. Eating too much fat, sugar, salt can obviously lead to obesity, diabetes, and high blood pressure. Eating burgers and soft drinks daily increases the risk. Also, the lack of exercise. Exercise keeps the body healthy or in different ways. Without exercise, weight increases, heart become weaker. For example, a person who sits all day at the office may become overweight. Then we have abuse. So smoking and alcohol damages the organ more than like poor diet. It leads to lung cancer, it leads to COPD, it leads to heart disease. Alcohol can causes liver cirrhosis, high blood pressure. So these are the leading causes of illnesses. Then we have stress management. Chronic stress impairs the immune system. Long-term stress affect our health. For example, a student preparing for exam may lose sleep, feel anxious, develop headache, and eventually leads to some disease condition. So, conclusion is many illnesses can be preventable through healthy lifestyle choices. We'll move to the next slide, which is psychological and economical factors. What does the psychosocial means? It means psychosociological and social influences the health. For example, poverty. Poor people often have less nutritious food, poor housing, poor sanitation, and limited healthcare facilities. For example, malnutrition is very common among economically disadvantaged families. Education helps people understand the health information and they are more aware of the health conditions. Educated parents are more likely to vaccinate their children, and it prevent them from many different dangerous diseases. Then we have social support. Social support from family and friends improves the recovery very fast, as it gives a mental support, which is a very positive support that a patient gets when they are ill or they are recovering. For example, a patient with family support usually recovers fast after a surgery or knee surgery, as they get the full support of the family and their mental state is in a very well situation. So this generally improves the recovery process very fast. Then we have religious and cultural beliefs. Beliefs affect our healthcare decisions. For example, some patients avoid certain foods because of religious belief, and uh, this eventually leads them to some kind of diseases. For example, uh, due to the religious belief, a person is not taking any kind of non-veg items, and This is stopping that person from taking protein in the protein for their daily requirements, and eventually the not taking enough protein in their meal will definitely lead to some at a point it will lead to malnutrition, or the diet is also not balanced, so it may definitely lead to some kind of diseases. But then also we should always respect the culture and religious belief, and then we can improve their health in other way, or in the suitable way which they can also adopt and we can also provide. Move to the next slide. Illness behavior. So what do we understand by illness behavior? Basically, we have five stages in this. First, the symptoms experience. The person, at first, whenever a person falls sick, the first thing he experience is the symptoms. For example, I have fever. What I am experiencing? A raise of body temperature, loss of appetite. So these are the symptoms which I am facing due to my condition, which is fever. Then we have second stage, that is sick role. A person accepts that they are sick, and eventually, for example, I will tell that I am not feeling well today. So I may take some professional advice and go to the hospital, or take concern from them, or take medicines. Then we have medical contact. Also, in this also we seek for healthcare facilities. For example, visiting a doctor or nurse to treat whatever condition you are facing. Then we have stage 4, dependent patient role. A patient follows treatment, for example, taking medication on regular basis. Then we have stage 5, that is recovery. The patient become healthier again. He again goes back to the healthy state. For example, mm, a person was sick after taking medication, proper treatment, visiting the medical professionals, and they are now in a better stage. So these were the illness behavior, which is divided into 5 stages. Then we will see the role of nurse. What can a nurses do to prevent the illness? For example, at first they assess, identify the risk factor early through screening and history taking. Proper history taking and physical assessment is very much necessary for a patient as well as nurse to know the actual cause, and the nurse will prepare the care accordingly. Then we have education, teaching patient about healthy lifestyle modification. For example, if a patient is consuming alcohol, or is smoking on the daily basis, we can give them suggestion not to do it, and if they do it, what it can lead to, and if they follow a lifestyle, how healthy they will feel. After that, we have counseling. Counseling means helping the patient to make better choices. Sometimes we are not aware of the situation. In that condition, helping patient cope with their emotional impact of illness is very much necessary. Then we have for in counseling, we will see one example, that is helping someone to stop smoking, or helping someone to not to consume alcohol. Then we have advocacy, in ensuring the patient has access to necessary resources. In this condition, we will in this advocacy, we will protect the patient right. For example, helping patient to get the right healthcare services. Whatever he is facing, we will tell him their rights, and we will lead them to the uh, we will lead them to healthcare services. Then we have care provider, delivering holistic care for acute and chronic condition. Provide This means providing treatment and give monitoring on the regular basis. For example, giving medication, checking vitals, suggesting some exercises. So these are the holistic care. So these are the few role of nurses, which is assessment, education, counseling, advocacy, and lastly, our caregiver, care provider. So we have come to the end of the class. What are the key takeaways we can take from this lessons are many illnesses are preventable, but lifestyle choices greatly affect health. Environmental influences, diseases, genetic can increase the risks, and nurses play a very important role in preventing all of this. For example, a person who eats healthy food, exercise on the regular basis, avoid smoking, has a very lower risk of developing diseases. So we will see the conclusion. So illness does not occur due to one and only one reason. It develops because of biological factor, environmental factor, genetic factor, lifestyle factor, and as well as social factors. All of these works togetherly. Understanding the multifaceted causes and risk factor of illness allows the nurses to provide evidence-based protective care by focusing on both prevention and treatment. Nurses act as a critical link in the healthcare chain, promoting the healthier society through education, assessment, and compassionate care. Better assessment today leads to a healthier patient tomorrow. So these are some of the references I have taken, and thank you so much for listening patiently.